My role at OSVI, I'm the GM, so I sort of oversee everything that we do. I won't touch on too much about us because I've got one of our main directors here, Tim Whitehead, leading knee surgeon, who will talk you through a little bit more detail on OSVI. You may have seen our logo running around throughout the year. So we sort of soft launched with the VAFA throughout 2024. We've got some really cool initiatives that we want to run you through today. We'll start off with a video from our head of performance to really give you an idea on our clinic, on our institute, an overview of what our model looks like. Then I'll hand over to Tim to talk a little bit more through us and our model. And then I'll come back on and talk about a key initiative for the VAFA, which I think is definitely a game changer when it comes to injury.
I'm Argel San Jose. I'm the head of performance here at OrthoSport Victoria Institute. The uniqueness of OSVI is what we call a vertical care model, where you can get all your services all in one place. Someone who might need a sports doctor or an orthopedic surgeon might need to go to a clinic, but then after that they need to look for a physiotherapist and they have to go to another clinic. They might need some performance coach, an S&C coach, an AP. Whereas here at OSVI you can have all of those services all in one place. All our clients would have all their practitioners in one roof, and that means all their practitioners are communicating between each other. All of our practice is guided by research. We throw research now, or evidence-based practice, as some sort of a cliche nowadays. We say evidence-based practice. But here, because we have a research department that actually looks after everything that we're doing here, we are ensuring that everything that we're doing here is literally informed by what's the best research so far.
So as an integrated musculoskeletal clinic and the official partner of VAFA, we're excited to announce a partnership. So I'm going to hand over now to Tim, one of our directors, and a leading knee surgeon, Professor Tim Whitehead.
So look, that little video from Argel really highlights the sort of the visual aspect of what we have. It's a pretty special place at OSVI. I've been an orthopedic surgeon for 20 years now, but having an integrated model of care with really highly specialised people was a dream of ours sort of 5 years ago, which we've been open now for just nearly on 2 years. So one of the key aspects of this is bringing all the shareholders in musculoskeletal health together in a vertical integrated care model. But really key to that is using evidence-based medicine with our laboratory that's our main thing. So in addition to everything you have here, orthopedic surgery and an emergency care clinic, physiotherapy, sports medicine, strength and conditioning, biomechanics, performance testing, podiatry and exercise physiology. The key aspect to that is the biomechanics laboratory. One of the things that we've really worked on here is to bring the university grade testing into our institute. So we've taken the team from ACU and Melbourne University and we've implanted that into a clinical setting, and it's really unique. We're the only place in Southeast Asia that has that within a clinical setting. What that does is it gives us an enormous advantage, if you like, to use those tools to manage our patients. So it's not just for research, but it's also for managing our patients and also for our athletes moving forward.
So as you can see, we're quite an extensive clinic with many different things. When I mentioned before about an initiative that we launched early this year, which I think it will really benefit the VAFA, is that we identified that when it came to injury assessment, most of you guys would have injuries on a Saturday and they would go and sit in an emergency department at a hospital for hours, right? Might walk in and see a GP who then puts him onto imagery, then sends them away 6 hours later with a referral to an orthopedic surgeon or whoever that might be, and then they might struggle to get in to see someone. So the loss of time to reduce the injury time they're out of the game for, we noticed. So early this year, we launched a sports injury emergency clinic. Works very similar to an emergency department, and this is a game changer for VAFA athletes. We're open Saturdays and Sundays. Effectively, you come through our doors. Your average wait time is about 10 minutes. You'll see a triage nurse straight away. you'll get triaged. We have sports doctors there ready to go, and they'll assess, and then they'll put you on your pathway. So whether that pathway might be that through to allied health, physio, or the pathway through to orthopedic surgery, or so we can set that up within days. So average wait time, 10 minutes. You'll get imagery. We do bulk bill all imagery straight away. So you'll get assessed within hours of seeing us. And then on Monday morning, you might, if it's a knee, you might get an opportunity to see Tim, and then get you back playing as quickly as possible. So again, we think this is a absolute game changer when it comes to injuries for you guys. We're open 12 to 7 on a Saturday and 12 to 7 on a Sunday. There is a fee, definitely. We run like an emergency department, but thankful to Marsh Insurance, up to 90% of that fee is covered through your VAFA insurance. So effectively, you're paying dollars for an opportunity to get back on the park pretty quickly. So we'll be out here for most of the day. So if you've got any questions, we've got a handout on this as well. Yes.
Just with the insurance, yeah. So the integration. So you have someone there that can do the paperwork for the first time. They've actually got to pay for it, come back, and then we have to follow
it through. Yeah. We will talk to Marsh to see if that is a possibility, but at the moment, no.
And is it 90% of all things or specific?
So 90% of the weekend clinic, which is there's a fee for the weekend clinic, and 90% of allied. So if there's anything you do through us, from so if you come and see us get treated, you go through allied health, whether it be physio or whatever that might be, it's all covered. Providing it, obviously, you've done the injury through the VAFA. Yep, but obviously. And you can see there's everything we cover. We have everything on site. We have plasters on site. We have boots on site. We have everything to cover any injury that. So this is available for you guys for the VAFA on a Saturday. And that's why we've partnered with you, because we see as a business, our values align very well with the VAFA. We're all ex-VAFA, either school or football as well. So we've got strong ties to you all.
What's that be?
It's $3.99. Yeah, so $3.99 to see a triage nurse and a sports. So they're dedicated sports doctors, so they're not GPs. So when it comes to sports injuries, they're really well assessed. So no, at the moment. We are talking to Medicare about, but that's a different conversation altogether. Yeah. So, but with your VAFA insurance, it's quite good. So we've spoken with Ambulance Victoria, so they know about our facility, so they will bring patients directly to us, and they can come straight to us if it's, and that's the whole idea as well. The ambulance ramping that you probably read about at the moment, we want to solve that problem as well, rather than sitting at an ambulance for 2 hours and then sitting in the emergency department for another 4 hours, when they can walk through us and get seen straight away. On a Saturday, the X-ray, they're open as we're open. You literally walk, what is it, about 100 meters, Tim? About 100 meters down the road, and we bulk bill it for you as well, so you won't have to pay for imagery. A lot of emergency departments will make you pay for imagery. They will bring that back to us pretty much straight away. So then we can assess and then put you on the pathway to recovery.
An enormous amount of work's gone into this from Lawrence, and we probably thought this was unobtainable a few years back, just with all the hoops we had to jump through. But Lawrence has really done a great job in getting this set up, so we're very, very thankful. Just a couple of things on that. One of the really main advantages, in addition to the low weights and the low costs and the expedited care, we're not at OSVI. We're not beholden to hospital on-call rosters, and so the exit strategy for patients to specialist care is at our discretion. So you can absolutely guarantee that you're going to get expert care when you need to go into that secondary or third pathway. So now we've got a bank of surgeons, physicians who can look after people, and have all been sort of worded up to be on call to look after people in an expedited fashion. So it's not something we can publicise, but it's certainly something I can verbalise and you guys know about. So I guess I just want to touch base on what it is specifically for the VAFA athlete. And I thought I should just divide it into performance, but also then if you're injured. So with regard to performance, and we've all seen it, you look at our players on a track and there's some good athletes and there's others that sort of struggle. There's others that can jump and others that can't. And one of the really great things that we have is assessing athletic performance with our biomechanics and our strength and our force plates. And then from that, we can then tailor programs for athletes to be better movers and to be better athletes and potentially better footballers. We've got the strength and conditioning for that. And one of the big things then is sort of looking at injury prevention. We can all see that, you look at a player running and think, oh God, they're moments away from a hamstring strain, they're tight and all the rest of it. So putting people through this program, a performance assessment, is critical. Well, not critical, but it's really important. The other thing that's important for us as a group is to try and baseline people's performance. And this is not something that's done typically. Usually someone gets assessed when they're injured, but then they're an injured athlete. So you're always comparing to the opposite limb in an injured athlete. So having the data on an athlete before they get injured is potentially very valuable for the athlete, but also for us. We can actually take the biomechanics assessment, the gated laboratory assessment tool, to a field of play. So the options are to bring an athlete or player into our facility and be tested, or we can actually take the Xsense machinery in a suitcase and take it out to the oval.
Which we actually trialled last year with the Big V.
Yeah.
So the Big V, all 44 players across male, female, got access to the testing, and it went really well.
It works really well, and you can actually take it out there, as I say, and then the strength testing the valid equipment comes with them and force plates, so you get a very good assessment of your athletes to the field of play. So we'd be certainly happy to talk to any players or clubs about that who'd be interested in looking at that. Once they're injured, whether it's through the sports injury clinic or not, they then move down a pathway of either non-operative management or operative management. And again, so in addition to having sort of world-class care, they're also then potentially put through the performance and the assessment laboratory. And what that does, and I certainly do it now for my ACL reconstruction patients, they get assessed at 3, 6, 9, and 12 months after surgery. Based on that assessment, their program gets modulated. And so we work out, what are the things about you that need attention based upon this assessment, and then we target strength and conditioning things to ultimately fix those areas of concern. And we truly believe this is the absolute best pathway for athletes and for patients. And if you look around the world, we're not the first to do it. There's some others around the world that have done this for many, many years, and certainly they've shown that they can reduce re-injury rates and reduce injury rates in athletes as well. So I might just leave it there. We're going to be here for the morning and be able to answer any questions you might have. And once again, very, very grateful to be able to speak to you guys today. So thank you very much.